back, YouTubers, to my channel of an everyday life of an Aspie. If you're following me and you're new to my channel, I'm AspieAnswersAll, or Aspie for short, as I'm known for many of you who are, my returned, followers and supporters on this channel. Thank you very much. I do about basically mental health versus sharing my life stories with Asperger's syndrome, OCD and the like, just to give you a lowdown of everyday things of what goes down with me in the territory of these different symptoms, diagnoses, shall we say, so that you can get a lowdown of what I'm like as a person as a whole, hopefully, regardless of this, try not to let the label of the Asperger's syndrome let me down. I also bring out some tips and advice along the way of certain, everyday health problems we go through, regardless what it may be, hopefully just to manage and cope with everyday strategies. Some of it may help for you, and many the return of some of the stuff that you do may not work for me, but it's just a matter of respecting one another and hopefully just doing what we can that's right for us. I also basically, with these tips and advice, notice that sometimes we just need to go step by step with some of the management plan or treatment plans that may work for us, and just not to give up just after one shot, I believe. Also, just to put a disclaimer out before I begin this, that I'm no medical doctor, I'm just a normal everyday Joe Blogs by name of Karen, just sharing my life stories and experiences basically with these everyday conditions and whatnot. So if you see any signs and symptoms that may sound similar or ring alarm bells to you, do seek professional help or second opinion or medical advice for you or the loved one that you are concerned about. I don't wish for anyone to condone to hurt themselves one way or another. Also, just to give you a lowdown also, that besides the mental health and awareness versus sharing my life stories, I do other bits and pieces along the way as well, of some messages of hope to uplift you all and support you all in your everyday struggles, regardless what it may be. So hopefully that we can just gain a better understanding, and also just getting to know one another one-on-one, hopefully, in this screen, even though hopefully maybe one day I'll meet people in general. Anyway, let's begin this. This is the Let's Talk Men's Health that I've forgotten to add to my series right now, and this one's all about osteoarthritis of the Let's Talk Men's Health. Okay, let's begin this. As we know, basically, or should know, there are over 140 different types of arthritis that is around right now in the health, sector of things. Osteoarthritis is the most common form, however. Alright, many people may question what is osteoarthritis, because obviously at this point of time I'm going to link a diagram up to my video right now as well to describe more, obviously, that will show the differences between the normal joint versus the joint that has osteoarthritis and then rheumatoid arthritis, so that you can see the difference behind it all, which I'll hopefully elaborate more further about those other ones later on in the piece if you want to know more. But let's begin this. Osteoarthritis, as we know, it can be really painful, and this occurs when the cartilage in the joints starts to break down, obviously, and then there'll be no, fluid left remaining to protect that part of the joint, regardless what it may be it the knee or elbow joint especially. The cartilage obviously becomes really thinner, rough, and in some instances bits of it may break off, or the cartilage will just wear away altogether. Without the cartilage, obviously, cartilage acts as a shock absorber, pretty much. Imagine a car engine with an engine with no, shock absorbers. There's no brakes, obviously. In this case, for the joints of the body, basically acts as a shock absorber, acting as a protection. That then, if there wasn't any, shock absorbance left, obviously joints will become stiff and become very painful. I can witness this because obviously my father suffers from this, and it can be really emotional and painful for me to watch sometimes when my dad tries his very hardest to just get on with his everyday activities, regardless. Two thumbs up for him, high praises that he just gets up and tries to do stuff when he can, if the pain just doesn't get too much. Often some people may, describe the pain as basically being like a shattered piece of glass going between the joints. To compensate for the lack of cartilage, sometimes bones may grow thicker at the ends, forming bony spurs that will then cause further pain and discomfort in the body. Osteoarthritis most commonly occurs in the joints that carries our weight and usually, supports the weight of ours, such as the hips and knees. But it is also common in fingers, hands, and spines, however. Okay, the signs and symptoms to look out for osteoarthritis, even though usually it comes slowly on in a joint over a period of time or months, even years. The most common symptom, though, however, is feeling the pain in the joint that gets worse towards the end of the day. Other common symptoms include of the following to look out for is number 1, joint pain, even while you're stationary or at rest. Number 2, swelling in the joints. Number 3, a warm feeling. Number 4, creaking sounds. Number 5, stiffness or restricted movement of the joints. Number 6 is you're feeling like the joint might give away. Sometimes with pain, it comes with osteoarthritis, can be intermittent, and it is not unusual for people to go for years without the pain, only for it to come on again. So it can be on and off for some of us. Okay, osteoarthritis, who gets it? Your odds of developing osteoarthritis increase as you get older, and as well as your joints that begins to age, as we know. Osteoarthritis is more common for, from the ages of 45 plus, but it can develop in younger people and joints that have been affected by sporting injuries or just accidents in the past that they may have recurred. You are more likely to develop osteoarthritis if you're overweight, as we know the extra weight will put extra pressure onto the joints and cause them to deteriorate even faster. Osteoarthritis, however, can also run in the family. We are more at risk, obviously, if we have a family member with osteoarthritis. Okay, step for getting tested. There are several number of health conditions that can cause joints to become sore and inflamed. So the doctor will most likely start asking a lot of questions about the type of pain that you're experiencing at that moment of time, where the pain may be located, if it gets worse or better within the movement that you make with those joints, if it gets worse or better through the day, and if anyone in the family has osteoarthritis. So they'll do a thorough examination of, obviously, basically doing your medical history versus just some questions, so that they can get a further, diagnosis for us, obviously. Then the doctor obviously will, proceed on to maybe doing a physical exam, which will mean moving the joint and feeling and listening for signs of your bones rubbing together. If they do suspect osteoarthritis, you'll be sent for an x-ray to view your bones and cartilage around that affected joint. Treatment options. As we know, there are no cure or, magic fix for osteoarthritis or any other mental health conditions that I've addressed. But there are many ways to relieve some of the symptoms and stuff from getting worse, and these will depend on the age of the person and that, as well as the severity. But here are a few tips. Again, depending on the severity of the cartilage damage, of the wear and tear and stiffness of the joint and your size, obviously, maybe the doctor will recommend particular exercises or low impact activities to reduce the pain and increase the flexibility of the joint. Another one is number 2, you may be prescribed some painkillers or anti-inflammatories to help with the pain, and in some cases be given a steroid injection into the joint. Basically, also, some people may believe in, no pain remedies, but just doing maybe, a form of acupuncture. Another one is number 4 is maybe just herbal remedies, taking some, stuff like vitamin D supplements versus all these other kind of supplements that supports your muscle, cartilage and bone development. Another one is number 6. If you have been suffering for a long period of time or the joint is in very poor condition, however, the doctor may discuss the option of surgery to repair or replace the joint. So basically that ends a quick one on osteoarthritis. Basically, give me the like for thumbs up for support. Comment below basically if I've missed anything, or just feel free to comment about how you go about your everyday activities with these everyday health stuff for the men especially. I'm hoping to address it for men. Try not to be sexist, biased or what have you. I'm just trying to open up a forum, hopefully, so that the men doesn't feel insecure about, discussing their health problems or just discussing how they cope with it, so that we can actually support one another regardless, men or women, because obviously everyone is different to how they cope and whatnot. So let's open it up for discussion. No judgmentality here. Feel free to subscribe to my channel if you haven't done so. Feel free to follow follow me on Twitter, Facebook, AspieAnswersAll. Feel free to also just share these videos around to hopefully educate, motivate everyone around us. No further ado, guys, thanks for your support, thanks for watching. Do what you love, love what you do. Until next time, Aspie signing out. Have a great day.